Well, I'm with Andrea Crossfield, who's the director of Smoke-Free Northwest at the end of our Winning Ways in Walkden. And Andrea, you were talking about the need to work with communities and not in parallel with communities. This is very much the kind of policy flavour of the day. But what's the realities of what you can achieve in the balance between what the professionals do and what work may be done in the community?
I mean, in tobacco control, we're really fortunate in having a very strong international and UK evidence base for what works in terms of helping people to quit smoking. What we need to learn more about is how we help people not to start smoking, and that's what today's been about, really. And I think in terms of how we find the solutions, how we find the answers, we need to work not only with young people, who are a really important part of that, but with wider communities, with parents, with families, and with whole communities, because young people have their role models within their family, within their wider community, and people really do care about whether or not young people in their community start to smoke, whether that's their child or their grandchild, or generally about young people in that community, because particularly when we're talking about smoking, everyone will have their own family stories about the impact of tobacco on their families. And part of my experience in working with partners across the whole of the Northwest, and previously in working at a very local level myself, is that when you involve communities in co-creating, co-designing the solutions, and even actually handing over the opportunity to create those solutions to communities and not dictating actually what any of those solutions can be, that if you're doing that alongside the other work that you know can make a difference, the work that you can do with schools, the work that you can do with parents, then the results that you get are even better, and certainly you make progress very much faster. And whether that's about tackling smoking in homes, smoke-free homes, and cars, whether that's about tackling young people starting to smoke, all of those are opportunities for us to really work with communities and to let go, be willing to take some risks. And I think, for me, that's where we've seen some of the sort of greatest pace of change, where we take some risks around this and trust young people and trust communities to get it right, because they do get it right. And our role is about supporting and enabling, and doing the other kind of wider policy change where we can also see that we'll make a difference.
So does this involve a different set of attitudes for professionals and different set of skills to release that little bit of control, to support and enable? Or would you say you've been doing that all along? Is there going to be a big change?
I think it is going to be a change, and I think it feels really hard. There's a big pressure to be focused on outcomes and achieving outcomes. And the reality is that the evidence base around some of this work isn't as solid as some of the evidence base around, for example, local stop smoking services. Fantastic services that really do help people to quit. We've seen that they can have an impact on health inequalities within a community. But at the moment, we're investing a lot in the things where there is a very clear evidence base. And what we need to do is work with communities to co-create solutions and build the evidence base together. And I think part of our role is about putting in place really good evaluation of those initiatives and sharing the learning across communities, and joining communities together too. So, whilst communities do want to work at a very local level with their community, they're also very keen to join up their voices with other communities and to learn from other people, in similar circumstances to themselves. And again, so that's about an enabling role for professionals. The other thing that I feel very strongly about is that you do still need to put resource into communities, and this isn't about people doing this for free. I think that sometimes people will want to be engaged and they will give so much of their time for free, but at the same time we need to put resources into communities, and we need to recognise that if communities are doing this work and improving their communities, improving the health in their communities, that we need to resource them properly to do that.
Interested in the point you make about people in communities want to tell their story to other people. We have professional communities of practice do we need to support communities in that storytelling? Because it sounds, if you can extend that from the local networking, the local conversations, the local community-based work to cross-community work, then you're really beginning to get some further benefits.
Absolutely, yes. And I think that digital technology, social networking actually provides us with really easy ways to do that. We've been working with a number of young people's groups across the region in the northwest, and yes, those young people have wanted to join up and talk to each other, but actually they want to talk to young people in the rest of England. They want to talk to young people in Europe and in Australia and in America, and they don't see boundaries in perhaps the way we see community boundaries, and they're really, really open to engaging and to learning and to really extending that communication outwards. And I think that's where you get to see change happen quickly when you do that, and you provide ways to facilitate that. And I don't think we've got any excuses with new digital media. I think those solutions are ready-made and there for us, and actually the young people can very easily create some of those with us for themselves.